Healthcare is rapidly changing with emerging technologies such as artificial intelligence revolutionizing diagnosis, treatment and care for patients and healthcare professionals. I have with me today Indian-born cardiologist and Harvard professor Jag Singh, who in his book Future Care explores exactly that idea, the rapidly evolving landscape of healthcare. Through a blend of research, analysis and real-life examples, Singh delves into the idea of how the future of care will be virtual, sensor-aided and digitally enabled, powered by predictive analytics. Dr. Singh, welcome to the show.
Thank you. It's a pleasure to be here.
Well, Dr. Singh, thank you very much for joining in. Your book, Future Care, which I have with me here, it basically talks about sensors, artificial intelligence and the reinvention of medicine. Just walk us through a brief in terms of when you started writing the book and the crux of it.
Absolutely. So I was interested in the sensor arena somewhere around 2005, 2006 is when I got interested in it and started actively doing research work in about 2009. I knew that this was the way care was going to evolve. However, I think it was around 2015, 2016 when I realized that the way we actually deliver care in the hospital, at least in the United States, was not very efficient, was not very equitable. And I felt that the integration of sensor-based strategies with remote monitoring could potentially change the way we manage patients. So I started writing this actually a year before COVID, and it got catalyzed by the whole COVID process because I think suddenly there was this burgeoning era of digital care that we were delivering during COVID because we were all trying to stay distanced from hospitals. So it really manifested slightly before COVID, but I wrote it during the COVID period.
Okay, but explain the idea of healthcare being virtual as well as sensor-aided.
So virtual means that patients can get care anywhere, wherever they are, from any doctor, anywhere in the world, ideally, but anywhere in the country, for sure. So some of that we already understand through the proposition of telehealth and telemedicine. Now, when you see a patient virtually through telehealth, you're really not examining the patient. So it's kind of a sophisticated telephone call. But if you want to make that visit more objective, that's where you have sensor-based approaches that can make it more objective. So you can have vital statistics such as temperature, heart rate, blood pressure, even chest, lung sounds and heart sounds can now be sensor-driven data that a clinician can get. So if you want to make a virtual visit really objective, having sensor-driven data actually enhances that clinical visit.
Okay, so just give us a sense in terms of how exactly is this going to change the way we receive as well as deliver healthcare?
Absolutely. So I think receiving care would be probably the way to start first. I think patients who don't want to come into the hospital. So let's take a patient of heart failure who, coming into the hospital is quite the journey, finding their way, parking, driving, finding their way into the hospital crevices to meet their clinician, which can be an experience that actually may worsen their heart failure. So I think many of those instances, those patients can actually be followed from afar because a lot of the parameters of heart failure can now be digitized and can be actually measured through sensor-based approaches that can allow that patient to be followed from a distance and managed from a distance. So that information from the heart failure patient can come to the clinician. You have enough objective parameters as to decide how you're going to treat that patient, and you can deliver the care remotely to those patients. So there are many other nuances to this, but I think looking at it from the balcony, this is kind of the most perfunctory way of explaining it.
Okay, but what I'm sensing is that a lot of this is probably to do with chronic care?
Absolutely. So, if you look at why healthcare is non-sustainable right now, it's because chronic care is eating away at the national exchequer. At least in the United States, 3 of every $4 are spent in looking after patients with chronic disease. So I think, if you look at the chronic diseases, and this is for the audience, give you an example of it is diabetes, hypertension, chronic obstructive lung disease, heart failure, the 4 big ones out here are all chronic diseases. And many of these chronic diseases now can be managed with sensors from a distance. So you can actually reduce the cost of it potentially in the future. So I do feel that if we want to really make headway into reducing the amount of expenditure on healthcare, chronic diseases is the way to go, and creating digital pathways in managing each one of these chronic diseases is the future.
Do you believe every organ can be digitized?
Oh, absolutely, 100%. Maybe not right now immediately, but there are efforts going on to actually digitize every organ.
Currently, in the current scenario that we're in, which are the organs which are probably most digitized at this point in time? For example, where exactly is AI being used most effectively in healthcare?
Absolutely. So being a cardiologist, that's my comfort zone. I can tell you that, in the cardiovascular space, you can get information about every electrical signal from the heart. You can get information about heart rate, blood pressure, cardiac output, cardiac contractility. So there are several parameters that are already available for the heart. The lungs, again, can be digitized. You can get information regarding voice. The voice itself can be digitized. And by looking at, there are certain apps that actually hearing the voice using AI-based strategies can diagnose whether patients have tuberculosis or whether they're going into heart failure. These are low-cost options for the future. And besides that, there are digital signals now that can help assess what the respiratory tidal volume is, what the respiratory excursion is. So if you look at every organ system, there are ways that they can potentially be digitized, and this information can be then hopefully integrated into what I just said, the digital dashboard.
Okay. Your book is peppered with real-life examples. Give us one example where AI or digitization in health has been used effectively.
So the book is, as you said, made up of patient stories. And I think that makes it special because it touches on real-life examples that allow us to understand where healthcare is now and where it potentially can be. One of the stories, so there are many stories, and I could say something as simple. So I was looking after a CEO of a company who actually, this is a really simple example. I'm not going to get into the AI aspect with this example, but a patient had a heart rate which was always in the 55-60 range, and he noticed that his heart rate now was about 70. Now, if you went to a normal clinician and said, my heart rate's 70, you would say that's a normal heart rate, so you don't really have to do anything about it. But this patient had been tracking his heart rate and noticed that there was a slight change, well within the normal range, but using his personal data, there was an increase in the heart rate. So one of the things as a cardiologist I thought is maybe he's developing some signs of heart failure, or there's some element of decompensation, that's why his heart rate's gone up. So I obviously did an echocardiogram to look at his heart function and found, lo and behold, that he had actually developed a cardiomyopathy and had developed heart failure very early in the stages. But it shows you that some of these digitized signals, as simple as heart rate, in a patient with continuous tracking or continuous surveillance, can allow us to actually not only predict, but monitor patients and potentially also avert disease.